Andres, what medications can you continue and what medications should you stop prior to the colonoscopy?
Juan, that's an extremely important question because you don't want to leave that to the end or the day before or the day of the procedure. If the patient is, for example, a diabetic, if the patient has hypertension, if the patient is taking aspirin, if the patient has a history of seizures and it's taking a medication for that, if the patient is immunosuppressed because they have underlying inflammatory bowel disease or so, all of them need to be brought up with their doctor before they even start the prep when the colonoscopy actually it's being scheduled. So your doctor can tell you exactly which medications are okay to take and which ones they must stop or even decrease the dose prior and during the colonoscopy.
You know, Andres, there's some medications that I tell the patient that they should continue, particularly aspirin. Aspirin is one of those medications that are vital to the heart. People can have a heart attack after stopping their aspirin. So I tell them, if you're taking aspirin, don't stop the aspirin. There's another medication that I usually go around with the patient, which is the iron. This medication is safe during a colonoscopy, but it can obscure the findings when we're looking inside the colon. So I tell patients, if they are taking iron, to stop it at least 1 week before the procedure.
I agree, actually, and that leads us to the other condition that we frequently see, which is diabetes. Even if they're taking insulin or if they're taking oral medications, they're going to need the dose, it's going to need to be modified. So if you have diabetes, bring it up with your doctor so they can tell you exactly how to manage the dose of the medication that you are on to make it safe for your colonoscopy.
Andres, another type of medications that I like to discuss with my patients prior to the colonoscopy are the blood thinners or anticoagulation medications, because there are so many nowadays and these are very important for the heart. So I tell people, before the colonoscopy, if you're taking one of these medications, please ask your primary doctor or your cardiologist if you can stop the medication or if you have to continue the medication during the colonoscopy.
Last but not least, we're frequently asked about antibiotics that they may be taking for different reasons. I always tell the patients, continue the antibiotic, don't stop it because of the procedure, that's not a problem.